I don't know about you, but I am tired of waking up to hearing about another mass shooting and the slaughtering of innocent children. I'm tired of hearing a friend talk about another domestic violence dispute that went awry like it's just another Tuesday. I'm tired of perusing my Facebook to only find another friend has succumbed to illicit drugs. Have these things touched your life as much as they've touched mine? The root of these problems lie in mental health and substance abuse disorder, and Colorado often ranks last in both of those. We need to do something about it. I'd highly encourage you to watch the entirety of this video if these things have touched your life. I've spent the last week diving deep into how the behavioral system in Colorado works and trying to find ways that we might be able to help our community solve some of these problems. Before I jump into my findings though, here's just a few pretty devastating facts about the state of behavioral health in Colorado. Wow, so as you can see, Colorado behavioral health needs some help. I'm going to go ahead and break this video into 3 parts. First will be the structure of behavioral health in Colorado, followed by obstacles that our state faces, and then some possible solutions. I've also had the chance to speak to 2 guests about their opinion of behavioral health in Colorado. I'll go ahead and introduce them now.
Yeah, how did I get started? It's, how do you sum up 20 years in 2 minutes? But, I started out getting my bachelor's and master's degree at Colorado State University, got a degree in psychology and a master's in social work. While I was doing that, I was working with families who are at risk of losing their housing, people leaving domestic violence relationships, working with elders, running a child care center. I ultimately actually worked on creating a drug court for a college campus to help kids who were struggling with drug and alcohol use be able to actually stay in school, but stay accountable to being healthy at the same time. And while I was doing all those things, ultimately, I got frustrated with the system and I started volunteering in politics. And a state house seat came open, and I decided instead of hitting myself against a brick wall every day, I get a sledgehammer. I've run for office. I changed the policies for the people that needed it the most. And I'm proud to have been able to do that for 9 years at the legislature.
Sure, my name is Alexis. I've worked in behavioral health, which is the term that I will use to kind of encompass both mental and substance use, for 6.5 years. I started initially working at one of Colorado's largest medication-assisted treatment facilities that uses methadone and Suboxone to treat opioid use disorder. Since then, I've kind of stepped in the background a little bit, and I've worked in insurance credentialing.
So I'm going to jump right in to discuss the structure of the behavioral health system in Colorado. It's essentially made up of 4 critical entities. The first entity is the Department of Healthcare Policy and Financing, or HCPF. Now, this is a Colorado government agency that's responsible for legislation related to healthcare and financing. Second are the Regional Accountable Entities, or RAEs. They're responsible for distribution of state and federal funds to the various healthcare providers, as well as the auditing and reporting and structural design of behavioral health in Colorado. There are 7 RAEs responsible for a specific region throughout the state. The third entity are Community Mental Health Centers, or CMHCs. Each regional accountable entity has to partner with at least one CMHC. CMHCs are nonprofit organizations that have to meet a series of criteria for providing mental health care in Colorado. There are 17 of these centers in the state. Now, I also want to point out because they're called centers, they're not actually one specific place. They're more of an entity with buildings and services across the region that they cover. And fourth, you have the individual provider network, or IPN. If a therapist or doctor provides mental health services independently of a larger organization, they have to be a part of the individual private network to receive state and federal funding benefits. While there are other entities involved in providing behavioral health care in Colorado, these four entities in particular are responsible for 98% of the behavioral health care in Colorado. More specifically, the community mental health centers make up approximately 37%, while the individual private network makes up approximately 61%. This is going to become critically important when we discuss some of the problems associated with behavioral health. The next critical component in understanding how Colorado behavioral health works is the money. So the Department of Healthcare Policy and Financing collects all of the state and federal funds and grants and so forth, and then gives it to the regional accountable entities. The regional accountable entities use a series of formulas and a bunch of crazy math to distribute those funds to the CMHCs and the IPNs. All right, so I know that was a lot, and it'll all come together soon. But now that we've taken a look at how Colorado behavioral health is structured, I wanted to talk to our guests and see what their opinions on why Colorado is doing so poorly as it relates to behavioral health.
I think as a society, first of all, we're really good at responding to crises. And so when things get to a crisis point, who do we call? We call 911. What do police officers do? What do they know? They know enforcing the law. So when people are exhibiting behaviors that look concerning, and sometimes are, and there's no other resources, then all of a sudden jail becomes the place that people go.
Wow, Congressman Singer really hit the nail on the head here. So, have you in your own life ever had an experience where you or a loved one was experiencing a behavioral health problem? You can tell that inside their head they were struggling. Maybe they were screaming. Maybe they just did a certain drug that they weren't ready for and they were freaking out, or they were crying, or they were balled up in a corner and you didn't know what to do. Maybe they had violent outbursts. And what do? Do you just write it out with them and hope that it's going to be okay soon? Or do you call the police? And what are the police going to do? How are they going to help that person? They are trained to reduce the chance of something dangerous happening. And their initial response is to neutralize any potential threat.
And so you look at that, and then also the conjunction of what we are now seeing as our affordable housing crisis. At the same time we deinstitutionalized, we also decimated access to public housing. And so now you've got a critical mass of people with nowhere else to go, a society that's ready to respond to a crisis. And so all of a sudden our sheriffs are now mental health professionals, or they're having to act like mental health professionals when they're not ready to and they don't want to.
Now, I had someone call the police on me when I was having a mental health episode. I did nothing illegal, mind you. However, I was handcuffed and detained against my will. I was put in the back of a police car, transported to a hospital. People at the hospital aren't mental health experts, they're physical doctors. So I had a short 10-minute questionnaire. Nothing came out of it about my own mental health, except for that I seemed slightly paranoid, which I was because I was being detained against my will. I asked if I could have a lawyer. They told me I couldn't. And they gave me a bunch of drugs until I fell asleep. I woke up the next morning and they discharged me and continued to bill me $3,000. Did that help my mental health? Will it help anybody's mental health if that's the way they're treated? No, it just propagates the problem.
Some of the obstacles I think Colorado faces in terms of behavioral health, one huge one I can identify is the way that we utilize third-party payers and the organizational structure of our Medicaid system. I will say that I recognize that all people of socioeconomic status, require at some point these services. However, the administrative burden that comes on providers from taking either Medicaid or third-party like insurance is so immense and unnavigatable unless you have that experience, that a lot of providers are electing to not accept either, right?
So when Alexis mentioned the burden associated with collecting Medicaid and third-party insurance funding, I really wanted to dig deeper. Why was that such a burden? Why was it so difficult? And I discovered quite a bit. So let's go ahead and go back to my chart. You'll recall that the Healthcare Policy and Finance Department of the government collects the state and federal funds, which I will let you know is primarily Medicaid. They give those funds to the regional accountable entities to decide how to distribute amongst the community mental health centers and the individual providers. Now, Alexis is saying that many individual providers are choosing not to accept Medicaid payments due to the burden, which is really unfortunate because they provide 61% of the mental health care in our state.
A large population of clients, they were on Medicaid, so they were lower income individuals, even families.
I had to dig deeper though, and here's what I found. Susan Green wrote this article which sums it up well. Wow, this table tells us so much about Colorado's behavioral health. Now, the regional accountable entities responsible for distributing the federal funds is not required to disclose their financial statements. However, the community mental health centers, because they're nonprofit, are required to publicly share their financial records. So Susan had very meticulously went through their financial records to determine how much reimbursement each of the community mental health centers are getting reimbursed for providing mental health care. You'll also note on this chart in red is how much people in the individual private network are being reimbursed. I'm going to go ahead and pick on the largest community mental health center in Colorado, which is the Mental Health Center of Denver. They're also now called WellPower. You'll notice that for an hour of crisis intervention, this center gets reimbursed $818, which may be the amount of money needed to take care of a person that is in a crisis. However, members of the individual private network only get reimbursed $47 at a point where people are at their most vulnerable, when they need support and help the most. The largest majority of people that provide mental health and behavioral health in Colorado get reimbursed the least. That doesn't work.
One thing I've noticed is that a lot of people, a lot of providers, a lot of behavioral health providers, therapists, are electing to work remotely, privately, self-pay, or with like larger agencies that allow them to just work remotely and do counseling services. And why wouldn't they, right? Because they're getting paid a significantly higher rate than they would if they worked at a community mental health center or another substance use treatment center.
So I asked Congressman Singer outright what he thought of the funding distribution model in Colorado, and here's what he said.
I mean, there's a ton going on when you talk about, which organizations get which funding for which things. And so we have a lot of task forces in Colorado. This is a good thing and a bad thing. It's sometimes it's paralysis by analysis, but more often than not, it's to get as many perspectives as possible, and really look at periodic reports of what services are providing by which organizations and what new community needs are evolving. And so when new grants come out to look at additional community supports or different modalities of treatment, this is a flexible, ever-changing system. And that's, like I said, it's both a good thing and a bad thing.
I thought it was imperative that I at least got my eyes on some of these facilities myself. So I went ahead and checked out a few of WellPower's facilities to see what they were like and see what they offer the community. So I just stepped into the Crisis Walk-In Center in Denver, Colorado. There's roughly 6 of these crisis centers throughout the metropolis area of Denver and surrounding suburbs. It was quite an interesting experience. So essentially you can walk in, they're open 24 hours, 7 days a week, every day of the year. They've closed one time for roughly 6 hours, but other than that have been open since their conception, which I believe was 2014. Now, they don't have any psychiatrists on duty. The beds or locations that you'd stay are very, very short term. It sounds like you're typically referred to someone else. So I'm not exactly sure what happens here aside from maybe de-escalation. But the therapist and the folks were very nice. They have a very tight security, which I guess kind of makes sense. I had to put my belongings in a locker as soon as I entered the building. When I arrived, it looks like there was somebody being transported via police cars, which I find interesting. So I did get a chance to speak to an employee here at the Behavioral Health Solutions Crisis Center. They love the work that they do. They think that this organization is doing a good job of spreading awareness of what they do and how they can help, which is awesome. This particular facility will house people for 30 days if needed. And one of the patients here that I met outside indicated that it was a gift, and a gift that many people need to help get them off the ground. So that was neat. So I am sitting outside of the Dahlia campus, a 46,000 square foot facility designed to build community and help with various mental health services. It's a huge building. They got a garden, greenhouse, an aquarium. I didn't see that when I went inside. I only saw 2 people, in fact. The receptionist didn't even say hi to me. I just kind of walked around. I kind of wonder what this is for. But interestingly, I'm sure maintaining this building, keeping the electricity on in this building is not particularly cheap. It's buildings like these that Medicaid dollars are being used to keep up and running, which is really unfortunate. So I asked Congressman Singer what he thought of the community mental health center's efficiency.
I think they're trying their best, and you can always be more effective. And we know that because we're still 51st in the country in mental health care. I think they don't have enough resources to get the job done. I also think that there's probably some organizational efficiencies that they could be working on. We have a lot of different community behavioral health centers, and so I'd love to look at ways that we could reduce redundancies.
So I could not agree more with Congressman Singer's assessment of reducing redundancies and improving organizational efficiencies. Now, fortunately, relatively recently, new legislation was passed that created the BHA, or the Behavioral Health Administration. Now, their task was to catalog our current list of services and report how well we are doing as a state. A part of that required that these regional accountability entities provided them with a report determining how they distribute funds amongst the CMHCs and the IPN. The first required report was just given to the BHA August 15th, 2022. It did an exceptional job of covering how they determined how much funding to give the CMHCs, but it barely scratched the surface of how much funding they gave the individual private network. As a result of that reporting, and some help from a member-driven political committee combined, the Healthcare Policy and Finance Committee from the government have finally started listening to members of the independent private network. This has kind of ruffled the feathers of the community mental health centers. Check out WellPower's reply. So as soon as I found this post, I saw this picture that was so aghast that Colorado was going to lose a good deal. I immediately thought that was the face I made when I saw how much more these health centers get reimbursed versus individual private networks. But anyway, let's keep reading. So one of the opening sentences here indicates that these community mental health centers are providing the behavioral health needs of the state. They're not. We are ranked last. Whatever they're doing is not working. Now, I don't necessarily disagree that increasing access requires building capacity. I don't know if I agree that it requires a 48,000 square foot community center that's simply a garden and an aquarium. Now, this sentence is interesting because they're admitting that more providers can help, but only if funding increases. Well, I have an idea. How about we more adequately redistribute the existing funding to other providers? Give them a chance to demonstrate what they're capable of. So to encapsulate, the reason I chose to read this letter is this last sentence. Are we as a state taking away a strong foundation, a good deal for the state? You can hear the plea for help, the desperation to not do this. And of course, if you've ran a community health center and you feel like you're doing a good thing, you don't want that to be diminished or taken away, and I understand that. I do want to point out, though, that the regional accountability entities are primarily ran and operated by insurance companies. Now, that is an incredible conflict of interest. You have a nonprofit organization that depends on outside funding, and they have to receive that funding from agencies ran by insurance companies. That means these community health centers are at the mercy of these regional accountability entities or insurance companies. That's wrong. We need to fix that. So we've talked a lot about the problems associated with behavioral health in Colorado, but what can we do? What can you do? And what can our state do? I started by asking our guests.
The most important thing is, we all got to put our own oxygen masks on first, right? And so, so that means that we need to do the right thing for ourselves, and that means taking care of our own health, taking care of our own mental health.
This is an exceptional point. I'm going to go ahead and pause the video for a moment and put some information on the screen. The first piece of information is a phone number. That phone number is available 24 hours a day, 7 days a week, every day of the year. If you are having a behavioral health problem and you're struggling, call this number. They are fantastic. They will help you. It's confidential, it's anonymous. You'll get immediate help and feedback. Second, I'm including a list of all the walk-in centers available via the community mental health centers in Colorado. Now, I know we talked a lot about the bureaucracy associated with these centers, but don't let that stop you from visiting one of these places if you need immediate help. With that, let's go and see what else the guests had to say.
The first thing that I always tell people about addiction is the opposite of addiction is not sobriety. Connection. It's connection to your community.
How do you bring up mental health issues, right? Especially when you're experiencing them yourself. I think the most important piece is like finding your people, your tribe, right? And being able to tell someone in that tribe, someone in this group of people that you trust, hey, I'm struggling. Sometimes that's all you need to say is, hey, I'm struggling. Today is not a good day.
Hang out with your family. Talk to your kids. Enjoy your family and your family time. Spend time with your community. Find connection wherever you can.
Being a part of a community somewhere is extremely important. Find your tribe. Hunt it out. If you don't have one, find it. Whether that be through your career, your school, your family, or clubs. Go on Facebook, search for some groups of things that you like, and join those groups. Be welcoming to folks that join your community. Be that community for someone else. Be nice, be friendly. I know after COVID, we're all a little socially awkward and we're all kind of getting back out in the world, but let's rebuild our community. Let's be better together again.
The way that I got here to almost 8 years of being clean and sober from drugs and alcohol is actually Alcoholics Anonymous. A huge blessing in my life, but we talk about our tribes, right, and finding our people that understand us, and that's it for me.
Finding your tribe with some of these sensitive issues that you may be facing can be really difficult, but there are support groups for a wide variety of behavioral health issues, and I'd encourage you to seek them out. Whether you're a survivor of domestic violence, you live with somebody that's an alcoholic, you have substance abuse problems yourself, there are groups out there that can empathize with you and give you the support that you need within the community. You just have to find them. I've included a link in the video's description of some of the places to get you started. So we've talked about some things you can do for yourself and others, but what can the state or behavioral health system do? Let's ask our guests.
And making sure that, when the time comes, that if we want to be advocates, that we reach out to folks. Mental Health Colorado is phenomenal. They have a great brainwave program for grassroots citizens to step up and do the right thing. And so there's loads and loads of opportunities out there.
The second thing that I think everyday people can do is get involved in your local offices. Like, keep an eye on legislation that's coming out and vote. If there's an issue that you're really passionate about or you have experience with, you can go down to the state capitol when they are reviewing that ballot measure, and you can make a testimony. And you can speak to the legislators, to the congressmen, congresswomen who are going to be making that vote, and you can share your story and tell them why it's important to vote a certain way. And I think that is so powerful.
There is a slew of changes occurring across our nation. I cannot urge participation from the community in our legislative process more. Right now, as it relates to behavioral health, there's a bill, House Bill 1202, that relates to the creation of overdose treatment centers, which I'm a huge proponent of, and in fact, I will let Congressman Singer give us his opinion.
I think one of the things that I haven't mentioned is also harm reduction. I worked on a bill years ago that's only now being resurrected, actually, to allow cities to create something called life-saving overdose prevention sites. And these are places where people who are struggling with substance dependence can use under supervision, and then if they do overdose, they can be revived. But at the same time, they're finding access to services because they're in a place where people say, look, we'd rather you didn't use, but if you are going to choose to use, would you like some options about how to figure out how to address this? And in the meantime, let's keep you alive long enough so you can start to make those tough decisions.
I had the chance to visit the Harm Reduction Action Center in downtown Denver, Colorado. These people were treated with such dignity and respect, and they knew that they were going to be okay. What was also neat as I walked around the place is it was clear that they had a plethora of additional services and ways that they can guide people to get the help that they needed instead of dying alone on the streets. It was a very heartwarming visit.
There's over 100 overdose prevention sites in the world. There's never been a single death.
So as it relates to House Bill 1202, it's about 25% of the way through the legislative process. You can follow this bill, and there will be opportunities for you to speak for or against it in our legislature. Wow, we covered a bunch of material today, from the structure of behavioral health in Colorado to the problems associated with the structure of behavioral health, as well as what you and I and the community can do to improve the state's behavioral health. Now, for your convenience, most of the material I've covered, I've included links in this video's description so that you can check them out on your own time. Now, if you love the state of Colorado as much as I do and you appreciate the content that I presented today, I would be honored if you'd subscribe to my channel. I'm constantly checking out the state of Colorado and presenting things that you can see, eat, and do and participate in. With that, in closing, I'd just like to say, you're not alone. There are people out there that care, and there are people out there that can help you. Reach out if you need some help.